Hi, I'm Dr. Tanveer Janjua. I'm a board-certified facial plastic surgeon, and today I'll start following one of my patients who has decided to undergo Thermitight. Thermitight is injectable radiofrequency treatment that produces heat, and we inject it under the skin to produce collagen growth and tightening of the skin. And think of it as like shrink wrapping everything. As we do the procedure, the heat causes immediate shrinking, and then as the collagen grows, there's a delayed shrinkage as well, and that kind of tightens everything. It's a good procedure to help with patients who do not want to undergo a facelift or neck lift, or it is not bad enough as yet to do a facelift. Or if somebody had a facelift and now they say that I still see some looseness of skin around in this area, how can I get rid of that? That's where it comes in very handy. So that will be the plan today, and we'll go ahead and start documenting. So we have our patient here who has elected to undergo Thermitight treatments, and we wanted to demonstrate as to why we are doing that. From the front view, you can see that there's extra skin here that's loose along with some fat underneath, and we are going to turn a little to the side now and with the whole body, and we are going to demonstrate. You can see the hanging. Don't cheat by putting your chin out. There you go. Be fair. So right here you can see there's fat and loose skin as well. So the ideal treatment would be a facelift, but if somebody doesn't want it, the second best option would be to use the liposuction to remove some of the fat along the jowl line, and then use a Thermitight to tighten it so we can get more of a facelift effect without a facelift. And we are going to turn completely now, and now you can really appreciate the amount of looseness that we can see over here. And the younger you start doing this, the better result you get, but still, even as you get older, you still get a pretty good result. So we are shooting for that in combination of liposuction and then the Thermitight, which we will do around the ear all the way to the jowl area to tighten this area, and then to tighten the neck area as well. That's our plan. Today is the day of the procedure, and the patient is here, and we are going to follow her through the procedure. This is the opportunity to answer any questions and then get started. So do you have any questions at this time?
No, I don't.
Okay, great. Okay. And you already had some medication, so you feel relaxed?
A little bit, yes.
A little bit, good.
I can feel it.
Perfect. So we'll be giving you some more medication.
Oh, goody!
Yes, absolutely, to keep you nice and comfortable. That's our goal. Wonderful.
Okay.
Great. Our setup is ready. Patient has been injected and prepped with betadine. And now I'm going to zoom out to show you the setup. We have our flare camera, the infrared camera, and that's the monitor right there showing everything. And we'll be starting soon. And you can see in the camera right there that the bright areas are the hot areas, and it's going to continue to follow the hot areas, telling us where not to go and where to go when it gets to be too hot. We will go on to the next step of marking the nerve and following it to make sure we know the pathway. I'll take a marker, please.
I'll take these off. I
Sure.
don't need to see anything.
Absolutely.
What's this little tricky thing?
That's just to find the nerve.
Oh,
Remember we talked about protecting the nerve?
yeah.
So the nerve might have a branch going right off here, and we have to mark that. This is all the safe territory right there. We want to make sure that we do not get close to this safe territory. We have to keep it safe.
Yeah.
No, I'm just talking to the camera.
Okay. But I can hear you.
You can hear me as well, absolutely. So I'm marking the zone right there that I have to protect very carefully. And the way I protect is I use saline injections to kind of bring the skin up away from the nerve. This way we cannot get close to the nerve. And that trick has really served me very well. So right there we got all our markings, and this is perfect. Very excited. Let's go on to the other side. Thank you. to 5, please. So we have marked our nerves. You can see almost there's a little bit of branching going on towards the end, and I've created a little safe zone around both sides as well. The central markings are for the fat that we need to do the liposuction. Now we are in good shape, and we'll proceed with the injections. Now we are about to start liposuction in the area we marked in the submentum. We'll do that first, and then we'll go on to do the thermi. We have finished our liposuction, and now we will proceed with the thermi. Now we are about to start the Thermitight. So we have finished our procedure. As you can see, the patient's got the wrap on, and she's quite comfortable right now. She's more awake as well. The medication is wearing off. And what I want to show is that if she smiles, please go ahead and smile. We got a perfect smile, so the nerve is working. And I want you to pucker your lips like you're trying to. So you see a little bit of weakness right here, see? That is because of the injection, numbing injection. And the way I know is, it happened even before we started the procedure. As I was injecting, I was keeping an eye to see what happens, and I saw that this side, the numbing medication numbed the nerve. So within like maybe 2 hours, at the most 3 hours, this is going to start working just back to normal. So I have no concerns. My bigger concern was more this area. It went beautiful, so I'm happy and she's happy. We're at day 10 now after our Thermitight and liposuction, and I wanted to emphasize is the improvement in all the bruising. It is almost just a yellowish tinge, but the bruising is pretty much gone. And typically we don't even see this much bruising, so if you do, you can be rest assured that 7 to 10 days afterwards it's pretty much gone. You can very easily cover it up. And the marginal mandibular nerve is in great shape. I'm going to have our patient smile because she's very happy. You can see. I'll have her pucker her lips like she's blowing a whistle. There you go. So it's perfect. And I have zoomed in to show you exactly all the changes in the neck. Perfect. And the jowl area. And now I'm going to have her just gently turn to the left, the whole body a little. Perfect. Excellent. And you can see there's still loose skin, and with time it's going to keep shrinking and getting better and better. Now we'll have her turn to the right a little bit, please. And there we go. We can see that as well. So we will continue to monitor it for the 3 months total, and then take a final look at the result at the end. We are in good shape at present. Thank you. We are at 2.5 weeks after Thermitight and liposuction of the neck, and we are doing very well. From week to week we can see the change, and we can already see the change happening with the retraction of the soft tissue. And I will point out the change that I noticed. Prior to the procedure, the patient had a band going this way that was very loose. We don't see that band anymore, and all this area here is very hard, and that's good. That means that the scar tissue is working, collagen is building up, and it's retracting everything, and we can see all over. I'm going to have the patient gently turn a little to the right so we can see on this side as well. The change is happening. Now we turn it completely so you can see the change happening. Right now it's hard to tell, but it's definitely progressing slowly and gradually, and we'll take a look from the other side as well, right halfway this way. So you can see there's still a little bit of hanging skin there, but the hope is that with time the contracture will pull that up. That's what we are hoping for. There we go, exactly. And right now, just by feeling, we can feel some hardness as well, so it'll keep getting better and tighter. Perfect. We will follow our patient at 6 weeks mark from the procedure. So we are at 6 weeks mark, which is typically halfway from the healing time period of 3 months. And we can already see the change, and it's important to follow the halfway mark, and then we'll meet again at 3 months interval. And this is our lateral view, and you can see the skin, still is not completely shrunk. There's some loose skin here, and we are hoping that with time it'll continue to contract and give us the result that we want. I'm going to have our patient turn a little to the front. Great. And then we'll take a look on the other side as well, and you can see that we are already beginning to see the contraction. So we are going to keep our fingers crossed and check again in 3 months time. So far so good. We are at 3 months interval after liposuction in the neck and Thermitight on our patient, and we are following the patient today. And first, from the frontal view, straight ahead, you can see the change that has happened with the loose skin and the double chin that we used to have. That is much better. And now we are going to have the patient turn a little to the left with the whole body. Great. So 3/4 angle, you can see much better. And now we'll have to turn the patient completely to the side, and you can see the change there as well. So this is excellent, and I want to point out that this can continue for up to 6 months, even sometimes up to a whole year, and that is very encouraging. Thank you for watching the video. I hope you liked it. I love doing these videos and I really enjoy the participation and the comments and everything from everyone, and I will keep putting in more material. And if you like it, please subscribe to our YouTube channel so you can keep watching the new editions as they come along. And also we are active on social media, so please like us on Facebook and on Instagram, and follow us on Twitter. We will try to provide excellent stuff and keep you all engaged and exciting. Thank you very much for your time, and enjoy.